Hello friends, let us now learn some important points about the drug streptogramine. Streptogramine. This streptogramine causes synergistic combination. It causes synergistic combination of streptogramine A and streptogramine B. Streptogramine A is also called as dalfopristin. Streptogramine A is also called as dalfopristin. Streptogramine B is called as quinipristin. So, in the streptogramins, we have streptogramine A or dalfopristin and streptogramine B or quinipristin in the ratio of 70:30. Now, there is also pristamicin also is seen. Now, the mechanism of action is this streptogramine will bind to 50S ribosomal subunit and then it prevents the extrusion of newly synthesized peptide chain from ribosomes. That means it will inhibit the newly synthesized peptide chain to get separated from ribosomes, and thus it will inhibit the protein synthesis. The use of streptogramine is used in VRSA, MRSA and methicillin resistant enterococci also. Then these drugs are CYP3A4 inhibitors. So if we see the side effects, these streptogramines causes infusion site reactions and thus they cause venous irritations. So these drugs also cause arthralgia myalgia syndrome, and this streptogramine is also resistant to macrolides, Lyncosamide. It is resistant to streptogramins, right? So these drugs are also inherited together. So MLSB resistant. So resistant to, there is resistance to macrolides, Lyncosamide and streptogramins are inherited together by some bacteria, and that type of resistance is called as MLSB resistance. Then the next important drug is Lyncosamide. So next important drug is Lyncosamide. So the Lyncosamide's main drug is clindamycin. So in the clindamycin, if you see the mechanism of action of clindamycin, it is a translocation inhibitor. Clindamycin is mainly used as in soft skin and soft tissue infections. It is used in skin and soft tissue infections by staphylococci and streptococci. Penicillin G along with clindamycin can be used in toxic shock syndrome. Clindamycin is also used in pelvic inflammatory disease. It is preferred for prophylaxis of endocarditis following dental procedure. It is used in the prophylaxis of endocarditis following dental procedures. Then, if you see the main use of clindamycin is against the anaerobes. Especially it is used against anaerobes, like it is used against bacteroids, it is used against propionibacterium species. Then the side effect of clindamycin is this causes maximum risk of pseudomembranous enterocolitis and it also causes maximum risk of neutropenia. Now then if the patient develops pseudomembranous enterocolitis due to this Lyncosamides, then this pseudomembranous enterocolitis is caused by Clostridium difficile. So for this Clostridium difficile pseudomembranous enterocolitis, the drug of choice is oral vancomycin, but metronidazole can also be used. Thank you for watching.